heart disease rarely appears suddenly without warning. In most people, the body sends small, subtle signals days, weeks, or even months before a serious cardiac event occurs, yet these signs are often misunderstood, ignored, or attributed to stress, aging, gas, muscle pain, or simple fatigue. And this delay in recognition is one of the most common reasons why heart problems become life-threatening. So understanding the early symptoms of heart disease is not just helpful but potentially life-saving, because the heart, like any vital organ, communicates distress long before it fails, and the key is learning how to listen carefully and act early rather than waiting for a dramatic emergency. One of the most recognized symptoms is chest discomfort, but even this is widely misunderstood, because heart-related chest pain is not always sharp or severe. It may feel like heaviness, pressure, tightness, fullness, burning, squeezing, or a weight sitting on the chest, sometimes mistaken for acidity or indigestion, and this discomfort may last for several minutes, come and go, or worsen with activity and improve with rest, which happens because narrowed arteries struggle to supply enough blood during exertion. Another very common but overlooked symptom is shortness of breath, especially during simple activities like walking, climbing stairs, or talking, and many people assume they are simply out of shape or tired. But breathlessness occurs when the heart cannot pump efficiently, causing fluid buildup in the lungs, making even mild effort feel exhausting. Unusual fatigue is another silent warning sign, particularly when everyday tasks suddenly feel harder than usual, and this is frequently seen days or weeks before heart events, especially in women, where extreme tiredness may be the only symptom, making it dangerously easy to ignore. Pain or discomfort spreading to the arm, shoulder, back, neck, or jaw is another classic yet misunderstood signal, because heart pain often radiates along shared nerve pathways rather than staying limited to the chest. So someone may feel an aching left arm or jaw tightness without realizing the heart is the source. Sweating without clear reason, especially cold clammy sweating, can signal the body's stress response during reduced blood flow to the heart. And when this occurs along with discomfort or dizziness, it should never be dismissed. Nausea, indigestion, bloating, or a feeling of stomach upset are also frequently mistaken for digestive issues when they may actually reflect cardiac distress, especially when accompanied by weakness or lightheadedness. Dizziness or fainting episodes occur when the brain temporarily receives less blood due to abnormal heart rhythms or reduced cardiac output, and these episodes may appear mild at first but can be important warning signs. Palpitations or irregular heartbeats, the sensation that the heart is racing, fluttering, skipping, or pounding, may indicate arrhythmias that interfere with efficient circulation, and although occasional palpitations can be harmless, frequent or prolonged episodes should be evaluated carefully. Swelling in the feet, ankles, or legs often develops gradually, and many people attribute it to long hours of standing or aging, but persistent swelling may indicate heart failure where the heart struggles to pump blood effectively, leading to fluid retention. Sudden weight gain over a few days from fluid buildup rather than fat can also be a critical sign of worsening heart function. Persistent cough, especially when lying down, may be linked to fluid accumulation in the lungs rather than a respiratory infection. Difficulty sleeping flat and needing extra pillows to breathe comfortably is another subtle but telling symptom of heart strain. Reduced exercise tolerance, where someone who once walked easily now tires quickly, often signals early cardiac limitation. It's also essential to recognize that symptoms differ among individuals, women, elderly patients, and people with diabetes frequently experience atypical symptoms such as fatigue, nausea, back pain, or breathlessness without chest pain, leading to dangerous delays in seeking help. Many believe heart disease affects only older men, but risk factors such as stress, sedentary lifestyle, obesity, smoking, high blood pressure, and diabetes are increasingly affecting younger adults, meaning symptoms at any age deserve attention. Another dangerous misconception is waiting for pain to become severe, when in reality early mild discomfort may be the best opportunity to intervene. Heart disease also develops silently over years as cholesterol plaque gradually narrows arteries without causing symptoms until blood flow becomes critically reduced, which is why regular screening and listening to small bodily changes are equally important. Emotional stress can also trigger symptoms because stress hormones raise blood pressure and heart rate, increasing oxygen demand and potentially revealing hidden blockages. People recovering from heart procedures must remain especially vigilant because new or returning symptoms may indicate graft or valve issues. Recognizing symptom patterns is crucial. Pain triggered by exertion and relieved by rest suggests angina, while symptoms that persist or worsen even at rest may signal a heart attack requiring immediate medical attention. Sudden severe breathlessness, crushing chest pressure, cold, sweats, and fainting should always be treated as emergencies. Beyond identifying symptoms, prevention plays a major role, and maintaining heart health through balanced nutrition, regular moderate exercise, proper sleep, stress control, medication adherence, and routine checkups dramatically reduces risk. Stopping smoking improves circulation quickly, controlling blood pressure protects arteries, managing cholesterol prevents plaque buildup, and maintaining healthy weight reduces cardiac strain. Hydration supports blood volume balance, while avoiding excess salt helps prevent fluid overload. Daily walking strengthens the heart muscle, improves oxygen delivery, and boosts overall stamina. Understanding family history allows earlier vigilance. Learning to monitor blood pressure and heart rate at home encourages proactive care. And most importantly, never ignoring persistent or unusual changes can save lives. Because early action often transforms a potential emergency into a manageable condition. The body whispers before it screams, and those whispers, slight fatigue, mild breathlessness, subtle chest pressure, unexplained swelling, irregular heartbeat, or unusual discomfort, are messages asking for attention. And by respecting these signals and responding promptly, individuals can protect their hearts, prevent complications, and ensure longer, healthier, and more active lives.